Nito ko tetutietab tililindo ole inyorune logoiwek tugul chetinyegei ak kanyoiset cheboto kanetisiosiek chetoretin eng teretab mionwogik.
I am Dr. Anjumanara Omar.
Kainaik kegurena Luke Kipruto Arab Tuitoek.
My name is Dr. Justine Jolagato-Dioni.
My name is Dr. Waweru Monyo.
I am Dr. Shrikant Dalwadi.
My name is Dr. Frederick Kairithia.
My name is Dr. Beatrice Nganso.
Testai iger tetutietab tililindo eng Kass TV amu kimnatet naet.
Kongoi mising chitab Kalenjin itagat eng tetutietab rani kegureno Chemtai Kirui. Eng tetutieni kemi ak Bancy Murima ne inendet ko daktari nebo Crystal Homecare Kenya. Kibendi kingalale akobo ripsetab chi nemiani eng gaa anan home-based healthcare. Eng ngalalani kibendi kiboisie kutitab Kiingereza. Kongoi mising. Thank you so much, Bancy, for making time for us here tonight. We really appreciate you. Here at Kass Media, we say Itagat. That means welcome.
Thank you so much.
Yeah. I'm really excited about this conversation that you're going to build up. Since I reached out to you and you were planning on how to have this conversation, I'm really glad that you made time here so that we can talk about different aspects of, when it comes to healthcare services in the country. Yeah.
All right.
Thank you so much. Could you introduce yourself a little bit and
Right.
tell us about Crystal Homecare?
Thank you for having me. My name is Bancy Murima Ngonjiri. I am the founder of Crystal Homecare, where we do home health care. So by that I mean we have nurses, doctors, physiotherapists, occupational therapists, caregivers come to your home and deliver the health care requirements that a hospital would have done. So in my some of the services is critical care nursing, general nursing, physiotherapy, occupational therapy, and did I miss anything? I think that's it for now.
Yeah, interesting. And from what you've broken it down, Bancy, what is the difference between home healthcare services as opposed to the one at the hospital where we go in here and the process there?
All right, there's a difference. Home health is more supportive and more long-term compared to hospital care. It is also more family-friendly. It is also quite adaptable when the condition of the patient cannot change to some extent. Hospital care also marries each other with home care, but for convenience and reliability services, home care takes the lead.
Just to break it down a little bit, home-based healthcare service. I'm at home, I'm not feeling well.
Yes.
I make a call and then you come see me.
Yes.
As opposed to me walking to the
Yes. It is so easy because the time you'll have spent going to hospital, I'll come to where you are. I'll give you the prescription. There's a doctor who's going to come, a certified doctor. If it's medicine that needs to be given intravenously, there's also a certified nurse who's going to do that for you. So it's just that it is at the convenience of your home. It's also time saving, especially when you are having, let's say for example, your patient is bedridden. Assuming you have to transport them to hospital for a doctor's checkup, it is so cumbersome and very expensive. Even hospital transport is very expensive. But assuming we are coming to where you are, it will be quite convenient for you to receive the care you'll have received in hospital. So yes, I think that's the way to go now.
Really interesting. At times when you want to go to the hospital, you have to make an appointment.
Yes.
And so the doctor knows the next day or on Thursday I'll be having children coming in. How does it work when it comes to home-based healthcare?
It is instant. It is instant. Hi, can I see you? Depending on where you stay, because you see there's transport from point A to point B. But right now we've made sure that every location or where you are, we have a person there who is able to come quicker than transporting from somebody from Nairobi to Mombasa to come and see you. So we'll have somebody there to attend to you the same way. We have a general protocol that applies to every medical pinpoint person in every county that we do.
Yeah.
Yes.
Is it always like you have to come at home, or when I make a call and you talk on the phone, then you can?
It depends.
Yeah.
It depends. We have adopted we have left with some companies that do telemedicine, because now they have the structures to do that. They also, because they have doctors now who will speak to you on telehealth and also give a prescription. Again, this is home healthcare. So from the comfort of your home, you're receiving everything. So telemedicine is a complementary of home care. Yeah, I think it's actually almost the same thing, just that this is very virtual. Yeah.
And that's very, very interesting. I think one of the things as to why I really wanted you to come to the studio and talk about is just understanding that aspect of getting healthcare services and how seamless it can be, as opposed to knowing that, oh gosh, tomorrow I have to be in the hospital and you have to plan your day around.
Yes.
Yeah? What would you say are some of the things that you've heard from your patients in terms of the barriers of accessing hospital, for example?
First thing, in every healthcare is very expensive. You leave your house, you need transport to go to hospital. When you go to hospital, you have to pay for consultation. If the doctor needs to investigate and be sure of the diagnosis, there shall be lab works or some images to be done. So it is very expensive. That's one. Two, reliability. Assuming you have a sick child, will you keep getting offs at work? Not at this day and age. I think even employers want you to be at work to even do your duties. So those are things that that need to be those are things that really become that the reliability comes to be. And the other thing is, apart from reliability and time saving, there is better outcome at home. It is psychologically very I'm looking for it, calming. It's psychologically calming to have, imagine if a doctor comes to you and you're seeing your child being treated and then they go, and you don't have to carry them and then see other sick children. So psychologically it becomes a very calming position to be at when you have your home health at home. So that is how it differs to the hospital care. Because the hospital will be told, wait, don't, do. At home I'll be waiting for you to tell me move or stop. So those are things that I found it much convenient compared to hospital care. The other thing is it's more hygienic. A young baby who's been born cannot really mix up with sick children, but in a line, for example, you're queuing to go see the doctor, this one has a flu, this one has a diarrhea, and you have to share the same services because that's how it is. The other thing also, there is reliability when it comes to, the government has not gotten enough hospitals to those grassroots areas. So home care in this idea, because it brings the patient will be treated at the comfort of that small marginalized area. So that's how convenient it is compared to hospital.
Interesting, and I'm just still stuck in this introductory aspect and just trying to really understand how home-based healthcare works, and in terms of who provides these services, do we have certain criteria or qualification that someone has to have?
Yes. Before we even recruit or put somebody to work for us, if they're doctors, they have to have a practicing license. They also have to have an indemnity. For nurses, it's the same. They need to have a registered and licenses. For physios, the same. Apart from the caregivers who are not certified yet, but they are trained, so they come with the paperwork. And we also get time to induct them with what we do as Crystal. Because you see, everybody comes with different trainings, but you need to have a common way of treating patients wherever you are.
How does this come about? Do you know, Kenya, we are modernized and we are getting into seeing the modern ways of accessing services. You mentioned something about telemedicine that's digital, but I'm just wondering, like, how is it in terms of adoption of home-based healthcare?
So far, so good. We are getting there slowly, and people have gotten to an instant of rapid. The same way you want to order food, you'll actually ask for an online delivery. It's the same thing. Healthcare is also getting there. We also want things done quickly because that's where we get in. We cannot put everything as seamless as because some things we require you to actually have tests and images done, but we are getting there.
Yeah.
I think we are actually going upwards in terms of absorption and understanding. And also there are times when home health is the only way to go, especially when we're talking about palliative care. And now the doctor tells you this is the way we need to manage this patient. This patient requires more quality time with the family and not spend so much time in hospital because we are now doing supportive care. So yes, that's where we are.
Yeah, you mentioned palliative care,
Yes.
and I'm that person like pen and paper, you know. We're going to get back to that because I feel like that is a whole conversation.
Yes, that's a whole conversation and very, very deep.
Yeah, yeah.
Yes.
But I want you to understand when it comes to home-based health services,
Yes.
you mentioned it earlier, but just to break it down a little bit,
Yes.
what are some of the services exactly that someone at home who is watching is expecting to get when they're reaching out for that?
All right. We normally have critical care. Critical care comes when a patient is not so sick for hospital, but a little more sick for home. Let's say a patient requires ventilation. We've gotten to a place where we need to support the lungs, but the patient is not so clinically sick. So we have a patient on tracheostomy. That person will require critical care. Somebody is able to take care of them, to breathe at home. We have very large wounds, like burns, and now require almost daily dressing. So those are patients who require critical care. And then you have general nursing services. I want an injection done. I do not want to be admitted. Can I buy the medicine and you give me? Yes, we do that. And then the other thing we have is physiotherapy. I need to walk back. I've got injured, I've healed, but I need to walk. So can you come and do home physio for me? Yes, we'll do that. You have a child who is cerebral palsy. We have autistic children and they need occupational therapy. Yes, we come and teach all those things. We also have speech therapy for kids who have delayed milestones, and we send somebody to teach them from home. So you see, those are things that require really, it's out of hospital, but really at home, but needs, again, healthcare. The other thing also is, I think I've talked about every bit of what I do. Yes.
Yeah. And when you're welcoming a practitioner in your home, you have that trust, like this person who is coming in is going to give me the services that I require. So how does Crystal Home Care ensure that the team is providing the
So even
quality
before we send the person, we give the family a room to interview the people they want to work with, because it is more comforting when the family also chooses, this is the person I want to work with moving forward. Again, before we even get to even sign up and start the care, we provide the family with the documents that they need. Do you need to see the CV? Do you need to see the license? Do you need to verify it online? Because these things are government, they're actually out there for you to verify. So yes, you have to do that to make sure that the person you're sending is within your standards, is within the standards that are going to provide home health care. Yes.
Medical record is something that is private to people. Yes. So I'm wondering, with the home-based care, how does the anonymity or privacy ensured?
So in every home, I've set up a system where the nurses update a virtual report. That virtual report explains what the patient is going through, and that is also shared to the direct family members. Again, before we start, those are conversations you have, and also tell them these are the only people we can share with. So even if you come to at home and you are an auntie and the family has not allowed you to know what the patient is going through, we will not tell you. We'll have to ask the next of kin, hey, is this person supposed to know where we are headed at? What's the progress? So we cannot say until the required next of kin people who we have assigned contract as well. So that's the only people we share. But others to document, because it's very important to document in the things that you do for a patient. It is a requirement, those things are shared just within the circle of the direct family members and the direct caregivers. Yeah.
You mentioned something about the home-based care having different practitioners. So
Yes.
if I want a therapist, a doctor, nurse, how have you ever found yourself going to a patient and probably you're providing service and you're like, oh, this person would benefit from this and that, so you call out for
That's why before we even get to engage to a point of a long-term engagement, we normally do a pre-assessment. Pre-assessment involves what care, what is the best care for you, because you'll also find yes, in as much as you want to go to do home care, this patient will need maybe even images. For sure, let's go to hospital, get treated, get to know what we are dealing with, and then come back home. And then we are able to manage it moving forward. Yeah.
Do we work with specific hospitals, or it depends with
No. The hospital is given at the freedom of the client.
Okay.
All right? Because, you know, from there, it's not within my... in hospital, they choose what they want. They also get to pay from there. They also have specific doctors that manage them. So I cannot say I go to specific hospitals. No, that one we discuss with the family. I can only help them choose the best for this and this, but I don't have a hospital specific that I'll say I take a patient for this purpose.
Just to understand that, I don't want to sound scientific, but there's that word symbiotic care.
Yes, symbiotic care.
The relationship. So you've been caring for this patient, you've taken them to hospital, they're back, and probably there's cases where someone is worsening.
Yes.
How do we go about that?
All right. Remember when I spoke about palliative care, and these are conversations that are also being done in hospital right now. We are going to tell you we are headed like this. This is where this is going to be the prognosis. Prognosis, I mean. I'm trying to look for the layman's language. Prognosis means what's the next step? What are we expecting? So yes, when you're discussing the progress of the patient, we'll start from that hospital. The doctor said this is we're going to do palliative care. We have gone at home. I mean, anything can happen and this patient can deteriorate. So those are conversations you have with the family member. In terms of a family conference, you say, this is what we said, this is going to happen. When the patient worsens, what do we do? Do we rush to hospital? Do you want them to just stay like that? You know, those are things that are very, very sensitive. And again, so when the patient goes down, you have to communicate, regardless. When there's a sudden change of patient, probably it wasn't palliative care, the patient has changed condition, we usually rush to the nearest hospital. Yes.
Bancy, you've mentioned palliative a lot, and I think this is time to just break it down a little bit to understand what is it and how does it come about.
All right. Palliative care is end-of-life care. I will not mention diseases, what specific diseases, but there are things we cannot scientifically come out from. I do not want to say them because I'll sound like I'm not believing in God, but yes, there are things we cannot really come out from as a medic, right? So when we get there, we have those conversations very candidly, and you also give the family opportunity to discover what else do you want to do. Do you feel like you'll have taken them to India? Fine. If you feel you want to do this, fine. Again, this is family-supported care. Right? Yes, we shall have a conversation about it.
I'm just, I think some of us have had patients who, until the last minute, we've let them be at the hospital, you know.
Yes.
And even though the doctors are saying the best thing we can do is give this person painkiller.
Yeah.
There's always, especially for us, I don't know if it's a Kalenjin thing or it's a Kenyan thing, where you feel like you want to do something until the end, and probably conversation that needs to be had is probably this person would want to be at home at that stage, you know, and get the care that they need instead of being surrounded with, you know.
Yes.
Yeah.
So you should listen to what you're being told. And actually, there's acceptance. There's listening and accepting where this is where we are in terms of truth. This is where we are. and choosing the best care for your patient. Probably even that hospital is the best care from your point of view. So do not deny the patient that right. So moving forward, I don't want to say people should, no, it's palliative, everybody runs at home. You as a family, as the primary family caregiver, decide what is best for your patients. I think that saves you a lot of psychological drowning later, especially when the patient maybe succumbs. Yeah, so always give the best to the person you need to take care of.
I know it's deep, but I just want to understand in the cases where we bring this patient at home, and like I said, this is a huge topic we can finish here, but if we bring that patient at home, what are some of the services that we can expect from a home-based healthcare?
We have family counseling, if you need us to get there. You can also have the conversations. Actually, when you do family conference, it normally has the family members, it has the doctor, it has a counselor, a trained counselor, either from the hospital or from the family, whichever, but a trained counselor who is able to break down this and even have a debrief about it. It settles a lot even when the patient really changes. I think those are, they have actually been done. It's not new these days. People are actually saying the truth about the patient. You're no longer hiding, saying atapona, atafanya nini, but we're actually saying we are treating you. This is the best we are doing. We have given the maximum of the doses. We are not getting here, we're not achieving this.
Wow. I think at this point we need to take a short break, you know. Sometimes we talk about this conversation, but it's a very important conversation to have, especially for someone who's watching at home and they're like, what help can I get, you know? So we're going to take a short commercial break. When we come back, we're going to continue this conversation with Bancy Murima, who is the founder of Crystal Homecare Kenya, just to discuss and understand a little bit about even the financial aspect that comes with utilizing the services of having your healthcare at home. So don't go so far, we'll be back shortly.
Testai iger tetutietab tililindo en Kass TV amu kimnatet naet.